Dr. Jennifer Gander from the Department of Surgery at Emory University in Atlanta, Georgia, discusses her article entitled Association of Cardiorespiratory Fitness with Coronary Heart Disease in Asymptomatic Men. It will appear in an upcoming issue of Mayo Clinic Proceedings.
The main point of the study was to look at the association of cardiorespiratory fitness with coronary heart disease. The study population for this project was the aerobic center longitudinal study cohort. It contained approximately 30,000 men. Women were excluded because of low events. And all of the men that were included had to complete at least one baseline examination between January 1st, 1979 to December 31st, 2002. And they had to meet the following three inclusion criteria. So they had to be between ages 30 to 74. They had to have complete data for the outcomes and predictive variables we were interested in. And the men needed to be free of cardiovascular disease and cancer at baseline. So our univariate analysis was very similar to what the previous literature has shown. So we continued on and did a multivariable survival analysis that looked at the association between cardiorespiratory fitness and coronary heart disease while taking into account these other risk factors that were in the Framingham risk score, such as history of diabetes, history of smoking, cholesterol, blood pressure, age, and of course in this case sex. And we found that even while controlling for those risk factors, cardiorespiratory fitness was still significantly associated and protective against coronary heart disease. So men that were in the high fit category still had a lower risk of getting coronary heart disease compared to men in the low fit category. We suggest that physicians begin or continue to promote exercise and physical activity for their patients to improve their cardiorespiratory fitness and lower their long-term risk for coronary heart disease. In addition, we also think researchers should begin and continue designing these randomized clinical control trials that look at the changes in cardiorespiratory fitness and the impact on risk factors associated with coronary heart disease. We also suggest that these randomized control trials should look at how improvements in cardiorespiratory fitness also decrease an individual's long-term coronary heart disease risk as well as their long-term cardiovascular disease risk.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.